Welcome to Fields of Study from the Masonic Cancer Center. Today we sit down with Carlos Perez, one of the recipients of the Top Abstract Award from this year's annual symposium.
Hello and welcome. My name is Max Huber. I'm the Communications and Marketing Manager at the Masonic Cancer Center, and this is our next edition of Fields of Study, where we sit down with some of our researchers, some of our lab techs, some of our faculty and staff, and just get to learn more about them. We've got a great opportunity to do this as we are at stay-at-home orders here in Minnesota, and I have work to do, but this is kind of fun for me. I get to sit down and learn more about people. And today I have the pleasure of being joined by Carlos Perez. Carlos, thank you so much for joining me.
No, thank you.
Carlos is one of our 3 abstract winners from what would have been our 15th annual Cancer Research Symposium, which is supposed to be held on April 22nd of this year. Obviously, with the current situation, we weren't able to meet in person. We pared this down. We're postponing it indefinitely, but we still wanted to highlight our winners who would have had the chance to speak in front of the entire crowd. So Carlos, tell us a little bit about what your abstract was that made you a top 3 winner.
Yeah, so what we do in Carol Lamb's lab, she's my PI, is breast cancer research, and we're looking at the cellular mechanisms of breast cancer and how breast cancer grows, and also how it goes to other places in the body, which is called metastasis. And what we are doing is that we're looking at a protein called glucocorticoid receptor, and this is usually people relate the glucocorticoid receptor with stress because this was cortisol, and cortisol is usually it gets secreted when you're under stress. It's also secreted when you wake up in the morning. It helps you wake up as well. So what we actually think is that the glucocorticoid receptor is promoting not only proliferation or growth of the tumor, but also cells of the tumor traveling to other places and metastasizing that way. So what we're doing is that we're looking at certain modifications that occur to that protein, to the glucocorticoid receptor. And we think that those modifications are what are triggering the glucocorticoid receptor to cause the cells to go to other places.
Interesting. So
yeah.
with what you said, it sounds like I should sleep in more.
Yeah, something like exactly, right? So actually, that's a great point. So one of the things that we try to do a little bit with our research project is to kind of relate what people think as a stress and relate that to cellular stress. So at the level of the cell, at the level of the organs, how that stress may actually create certain or prone certain tissues to be more cancerous-like. Although we are a long way from that, but that's what we eventually foresee this research going into. And there are actually several studies that have relayed stress events with metastasis and cancer progression. So hopefully our research kind of like ties that social impact with more of like a cellular impact. But yeah, you should definitely see more as well.
Okay, you heard it from him. And he's in the 4th year of his PhD MD program, so the doctor said sleep in. You did mention Carol Lang, one of our renowned breast cancer researchers, along with Dr. Yee, our director. We have this rich history of breast cancer research at the Masonic Cancer Center. And what's that like for you to be in the lab and being mentored by such a strong, powerful, intelligent person?
Yeah, so Carl and I met actually a while back when I was an undergrad in the University of Puerto Rico. I traveled to Texas to an endocrine society meeting, and she was part of the leadership of the endocrine society back then. And I think right now she's also part of the leadership as well. And we met in one of the rooms and we talked about like, she met with a group of students, and we talk about like her research, and I actually got really interested in her research. So when I got to apply to the MD PhD programs in 2014, I looked her up and I saw she was at the University of Minnesota. I contacted her and she was really enthusiastic of me joining the University of Minnesota in the PhD program. And yeah, it has been really fun to work with her. So actually between the when I was accepted to the ND PhD program and then starting the PhD program, so it's like a 2-year, we are in medical school. But I did go to her lab for rotations, and she has been with me, mentoring me since I started the ND PhD. And you know, that floor in where we are at in the Cancer and Cardiovascular Research Building, in the 3rd floor, is not just her lab, but also is the SACDEF lab and the Schwarzenegger lab. So it's a lot of labs that collaborate with each other in breast cancer research. So it's really a fun environment to train.
Yeah, it's a great environment. But right now, you know, there's not a lot of research going on in the lab. So how has day-to-day work life kind of changed for you, and how have you adapted to not being able to be in the lab and be on campus, but, you know, being at home?
Right. So for me specifically, because I'm going back to med school for the last 2 years, I have to write my thesis. So that's like the big project I'm doing right now. I'm dedicating my time to just get that research done. So when I go back, then I can defend that thesis and graduate and rejoin my med school class. But in terms of the lab, we are still meeting for lab meetings every week, and we talk about different projects that we didn't got to present the data yet to Carol, and we just present the data to her. And we're also doing still the breast cancer journal club, which is all the breast cancer labs. And we discuss research there, and not only our research, but actually other people's breast cancer related research. So I think that has been really fun. But yeah, and then other people are writing review papers. So, you know, one part that is important about research is to read about what you do. So, and to keep up to date with the current literature. So a great way to do that is to review papers, writing a review paper, and people are doing that in our lab for sure. So, yeah.
And how is all of this, you know, whether it's the research, whether it's the journal review, all of that, how has that prepared you for the next step for the med school MD program that you're going to be going into soon?
Yeah, so I think, you know, it's very complementary because when I was taking the breast cancer classes in med school for the 1st and 2nd year, I will think about questions, research related questions. Yeah. So having that research component will help me to look at clinical questions in a different way that will help me improve patient care ultimately, or will help us improve patient care ultimately. And, you know, it's all about bringing, it's all about bed to bench or bench to bed. So I think that having that skill set of being in the wet bench lab and doing research will definitely contribute to the other skills of the clinical skill set as well.
Awesome. And then 5-10 years from now, where are we going to see Dr. Carlos Perez? What's going to be your study? Maybe where do you think you're going to be in the world?
Yeah, so ultimately I need to apply to residency for the next step after graduating the MD PhD. So I'm thinking doing that in either surgery or internal medicine. I don't know yet. I'm leaning more towards surgery. And then ultimately my goal will be surgical oncology. That will be the where I see myself in the future, and also conducting research at the same time. I'm also thinking about colorectal surgery because there's a lot of colorectal cancer in colorectal surgery. So I think that will be really fun as well.
Interesting. And you know, before you mentioned the University of Puerto Rico, and now you're obviously here at the University of Minnesota, a little bit of a difference in temperature and
just a little
location. How has that transition been for you, going from, you know, places where you might never see snow to the never-ending winters that we oftentimes have?
Yeah, I know. So yeah, I'm still impressed with the seasons, and you know, I learn something every time that winter stars or something like that. I never imagined that you couldn't use the running water outside in the winter, because, you know, in Puerto Rico it's 86 degrees all the time, and you would just go outside and clean your car or something like that. And then it just occurred to me when I arrived here back in 2014 that I was like, well, you cannot use the water outside, it's frozen. So yeah, this is just crazy stuff like that you never ever think about, right? Like I live in Puerto Rico throughout, all my life. So, but it has been really fun. Minnesota is super awesome. I really like the people here, and, you know, seasons are really cool. You are looking forward to something always. So, you know, when this winter, like we just have, we were looking forward to the summer, and now with the summer it's gonna get hot, and then we want to look forward for the fall. And so it's always really fun. And there's a lot of activities that are season oriented, right? Like fall, you go apple picking, winter, you go sledding or whatever. And yeah, there's a lot of fun stuff.
And as we're conducting this interview, I think it's like 70 degrees and sunny. So
I know, it's pretty awesome.
Beautiful Minnesota day. And hopefully you don't go too far, because with the track record that you have, you know, I'm sure that you could do a lot of great things here in Minnesota.
Yeah.
I always like to end the interviews with this question, and it's kind of a loaded question, and you can take it how you will, but and this could be with your personal life, with your research, with things that are looking forward. But in our current environment, you know, a lot of people are looking for hope. They're trying to figure out what's next. Like it's a situation that most of us have never seen before. We're stuck at home. Yeah. You're not able to see or hug your loved ones. But my question for you as we end this is, Carlos, what gives you hope?
Yeah, so, you know, I really, during these last few months or month, I guess, it seems so long, right, since we started this quarantine, at least in Minnesota. So I think that just the motivation of researchers and the medical community to just try to embrace and come up with solutions, try to embrace what is happening and come up with solutions. So I think a big inspiration for me is actually my spouse, my significant other. She is a pediatric resident at the University of Minnesota. And, you know, just seeing her just okay, I have to go to the hospital now, put the little, you know, mask on, and then go to treat patients or do whatever with patients. And it's just the little things, the little sacrifices, right, that people do to try to keep going. And that's really inspiring for me. Just the little stuff that people do and how people try to just come up with solutions, and how people try to just come up with different ways to cope with the situation. And yeah.
Well said. And, you know, we're thinking about your wife. That's a lot of our frontline workers. I mean, we have a lot of colleagues that are going in every day, and they're putting their lives on the line, because this is such a dangerous disease, and we're thinking about them all the times. We're hoping that people use masks. I mean, we don't want to be stuck at home, but right now this is what's best for everyone. And for people like your wife, your significant other, it's not an option. She's got to go in, but at the same time, she's making a huge difference, impacting tons of lives, and especially pediatric patients. These kids, they didn't want this. They don't want to make this decision, but somebody's got to take care of them. So thank you so much, and pass on our regards to her.
For sure, I will.
Awesome. Any last second words for us before we end today's interview?
No, I think my last words will be just to embrace the quarantine or the time at home. I think, you know, there's a lot of stuff to do. There's a lot of things that you can contribute to society, even if you are from your home, and people don't even think about it. When, you know, usually when you go to work, you're just hey, I'm going to work and all of that. But there's a lot of things that I think you can do from home, and you just need to embrace that.
All right. Well, if this whole doctor thing doesn't work out, I'm going to peg you as a motivational speaker. All right.
Yeah, that would be awesome.
All right. Cool. Ladies and gentlemen, thank you. This was Carlos Perez, the interview with him. Again, my name is Max Huber. Check us out next time here with Fields of Study from the Masonic Cancer Center.